Welcome to Coping with COVID-19. I'm Dr. Allie Sharma. This interview series is a safe space to collectively cope and share our stories through the COVID-19 pandemic. Quick disclaimer, please note that this interview series is for informational purposes only and it's not considered medical advice. Please consult your own provider for any issues you may be facing, and if you're in crisis, please call 911 or your local emergency services. Today, I'm honored to be joined by Jason Andringa. Jason is president and CEO at Vermeer Corporation, a global industrial and agricultural equipment manufacturing company making a real impact. Jason serves on the Vermeer board of directors and also on the board of directors of Raven Industries, the National Association of Manufacturers, and the Association of Equipment Manufacturers, and is also on the board of advisors for Camcraft. He's also on the board of trustees for the Nature Conservancy of Iowa and Central College, and on the U.S.-Brazil CEO Forum and the President's Advisory Council for Doing Business in Africa. Jason holds a Bachelor of Science degree in Mechanical Engineering from Calvin College, a Master of Science in Aeronautics and Astronautics from MIT, and a Master of Business Administration from the University of Southern California, the USC Marshall School of Business. I am bringing Jason on to join me now. Hi, Jason. Thank you so much for joining me on my podcast and Zoomcast, Coping with COVID-19. I really appreciate it.
Thank you. It's great to be here.
Great. So I'd like to start by focusing on you as a leader in business within the context of the manufacturing industry during COVID-19. And my first question is, given the specific context of your work, how have you been affected professionally by the COVID-19 pandemic?
It really has been very interesting for me personally and also for Vermeer. It's crazy to think back that when COVID-19 went from being kind of a distant concern to being a very imminent and real concern was the second week of March. And that was actually my last business-related trip for Vermeer. I was at ConExpo, which is the largest equipment trade show in the United States. And it was the Wednesday of ConExpo, and we had a customer reception on our booth that evening of ConExpo. And that was the exact evening when the United States announced that we would no longer allow travel between the US and Europe, which at the time seemed like a very dramatic move. But that also was the same night that there was the first positive case of an NBA basketball player, and the NBA went on postponement. Major League Baseball postponed spring training in the regular season. The National Hockey League postponed their season. So, you know, that night was the day that COVID-19 went from being kind of a threat that we were all aware of, but not necessarily feeling as though it was immediately here, to being clearly imminent. And then, of course, over the next week, really everything shut down. Over the course of the next week, schools closed, travel locked up, et cetera. So, it really, in retrospect, it's astonishing to think how quickly things closed up and how quickly it really did feel unprecedented. And I mean, it was the same kind of feeling that I had after 9/11, where you just really feel like what's happening is surreal. And you never would have guessed that in one night, the NBA, Major League Baseball, National Hockey League would all stop playing games. Schools would be closing. The idea of traveling outside the country was no longer thinkable. That all of those things happened essentially instantaneously was a really surreal feeling. And as a leader of a business like Vermeer, it feels surreal personally, but of course you immediately start thinking about, how does this affect Vermeer? How does this affect our team? Do we have a lot of people traveling in Europe right now or overseas that we need to get back? I was at ConExpo with dozens of people from Vermeer, and that day we had interacted with hundreds of customers. And, we were doing our best not to shake hands, to maintain social distancing. I mean, literally that Wednesday was the last day I ever shook someone's hand until now. And even that day, I was really trying to avoid shaking hands. And so, immediately you're thinking, of the dozens of us that are here from Vermeer, have we contracted it because we're in Las Vegas? And at that time, there was no evidence of it. And, thankfully, as time has played out, ConExpo did not prove to be some sort of super spreading event, which I'm very thankful for. But, you just immediately start thinking about, how is this going to affect Vermeer? How's it going to affect our dealers? How's it going to affect our customers? Are we going to be able to keep our team safe, et cetera? So I think surreal was the most accurate word of what it immediately felt like on that Wednesday in the second week of March, when COVID-19 became a very immediate concern.
Okay. And so from that point on, which you said was about mid-March,
Yeah.
what happened to, let's say, your workforce, business operations? What challenges did you foresee? And then after that, have you had to pivot? Have you had to put new policies in place? Have you had to make any changes as a result of all of this?
All of those things are true. Immediately, for every team member that could work remotely, we had them start working remotely. And I'm really proud of how efficiently and effectively Vermeer did that. Our IT department was tremendous, helping people get their computers and whatever they needed to transfer their work to home. And I frankly have been very impressed by how effectively, from everything I hear, our team members are working from home. And frankly, it's a testament to the telecommunications infrastructure that is in place that allows that to be the case. And we take pride in that as well, because Vermeer over the last several decades has been very involved, Vermeer Machinery, in installing the underground infrastructure that now allows telepresence. It allows you and I to have this conversation over video chat.
Oh,
It
wow.
allows our engineers to access the documents and the drawings that they need, which are oftentimes very big files, from their computers set up at home, and do their work and collaborate with their teams. So, that was something that went into place immediately and has frankly been very successful. But, already at that point, we were already starting to think about how we could keep our production team members healthy. And that has been a process. We have continuously ramped up the protocols that we have in place as time has gone on. And frankly, as the pandemic has increased in the places where we are manufacturing. So we immediately started with questions, a series of questions that would be asked to all of our team members. Are you feeling unwell? Do you have any of these symptoms? Do you have a family member that you live with that has been tested for COVID-19 and is still waiting results? We have a handful of those questions. And, if it's a negative answer to any of them, then they're sent home. And thankfully, with the CARES Act, there are provisions in place that when someone is sick, they can file for unemployment. So, that has been very helpful. And so, really, we've continued to ramp up. We now do temperature checks. At first, we didn't have the hardware to do temperature checks at scale. We do now. So we do temperature checks upon arrival for everybody that comes to work, including myself. And, we now have enough PPE, enough personal protective equipment, that we're doing face masks for anybody that works within 6 feet of another person for an extended period of time. All those team members wear face masks. So, we've gradually ramped up the things that we have in place to keep our team healthy.
Yeah, so that's incredible. You had screening by self-report, then screening by temperature, and also protection. Yeah, so a really good response. Now, have you seen any innovations or, kind of unanticipated positive things come out of this in the way that you guys reacted and quickly, adapted to the situation?
I would say, two things, one of which I already alluded to, and that is just how effective many of our team members can be working from home. I was talking with somebody on the shop floor, and that person said that he felt that he was getting even quicker responses from engineers now working from home than when they were working on site. And just because they have fewer distractions. And so, you would assume that when you can go physically, personally talk to an engineer, that would be about as quick of a response as you could possibly get to, get, an engineering change made or whatever needs to be done on the shop floor. But this person said, he was feeling as though the engineers were even more responsive working remotely. And that's because they don't have the normal distractions that they would have by coming to work, and the meetings and just the normal distractions that come in an office environment. So that has been a surprisingly positive thing, which we're going to try to keep leveraging as time goes on. And a second one that I would bring up, which is fairly closely related to that, is we're wrapping up the end of our current 5-year strategy, and we're going to roll into our next series of, we're going to do a 3-year strategy next. It feels like 5 years is a long time in these days.
Yeah.
So our next round of strategic planning is going to be a 3-year round, and myself and a number of others had plans to make a series of trips to go visit our dealers and gain their feedback. And we actually started it in January in Europe. So, we did get the European feedback gathered in person, but, COVID-19 flared up before we did the domestic trips or before we did the Latin America or Asia Pacific trips. So we've done all of that input gathering on WebEx calls or Teams calls. And we've been able to do it by individual dealers. We were going to do it in groupings of dealers in regional areas, but we've been doing it by individual dealer and finding that it's just been a remarkably effective way to do it. Instead of some of the maybe larger, more assertive dealers getting more of the airtime. When you do it individually by dealer, everyone gets an equal amount of time. So, that's just another example of being forced to do something in COVID-19, where as it was happening, we kind of said to ourselves, wow, this is actually maybe even better than the way we were planning on doing it.
Right. So
and
unforeseen benefits in this virtual.
Unforeseen benefits. And, I would say, within the production environment as well, I think there's going to be now a much greater awareness that if you're not feeling well, you should stay home. I think for a long time, there was kind of the perception, if I just have a cold or, if I'm not feeling great, I'll still go to work, without really thinking about how that may spread to the people that you work around. And I think that may be a permanent positive change as well, that people are more conscientious of their own health and how, if they're sick, it could affect other people.
Yes, and how important health protection is in the workplace, right? This emphasizes that. Now, just to switch gears a bit, how has COVID-19 and this period of social distancing impacted you personally?
It has impacted me a lot. I typically travel about half the time for work. I'm typically on the road about half the time. And, since that second week of March, I have not traveled for work at all. And so on the one hand, I am finding that I miss travel more than I thought that I would. I do like, as part of my job, that I get out and see customers, that I get out and see dealers, that I go to, association meetings, that I go to board meetings, et cetera. Frankly, at the end of this week, we were planning on having our Vermeer board meeting at our facility in the Netherlands.
Oh,
And I was really looking forward to that. And our board was looking forward to that. And the team in the Netherlands was looking forward to that. And that's been canceled. And so, those types of things, I am finding that I miss those things more than I thought I would. And yet at the same time, I'm thoroughly enjoying, from a personal perspective, the amount of time I'm spending at home. And this is my favorite time of year to be in Iowa. So to see spring arrive in April and into May, and to be around my kids at a time of their lives when they're just really fun to be around. My oldest son, he's in high school. My next daughter is at the end of 8th grade, and frankly, she's struggling because the end of her junior high and the end of her grade school experience was cut short, and she's a very social person. And then my youngest daughter is in 2nd grade. So, really my kids are just tremendous age to spend time with them. And I've been doing a lot of stuff with my son outside. This past weekend, I went for a bike ride with my daughter. When they're as busy as they normally are, those things don't happen. So, on the one hand, I miss traveling. And on the other hand, I've been given this opportunity to be at home at a time which is really a fun time to be around my kids. So it's been positive in that regard.
yeah, that's wonderful. So final question, thinking about lessons learned during this health crisis, which is still ongoing, of course, what advice or what lessons learned do you have for other business leaders, perhaps in the manufacturing industry or other CEOs, about flexibility and adaptability and pivoting to the virtual realm?
A couple things. I would say one is we are in no way trying to reinvent the wheel at Vermeer with regards to what we're implementing here. From the beginning, I've been very clear. Let's follow the guidelines that are out there. Let's follow the recommendations and the guidelines that are out there. The CDC are experts, WHO are experts. What the state is doing from a health perspective, what the federal government is doing, what the National Association of Manufacturing is pulling together, what the Association of Equipment Manufacturers is pulling together. There is just an incredible amount of information on what we should be doing. And, the themes are consistent. Those are the things that we have tried to do from the beginning. So those people that can work remotely should be working remotely. If you're feeling ill, don't come to work. Do we have the ability to do temperature checks? Yes, then let's do it. Do we have sufficient masks so that we can require them to be worn for those people that are working in close proximity? Yes, we do. So let's do it. None of that is reinventing the wheel. It is just simply being aware of what recommendations are already out there and following those recommendations. And then, the second thing I would say is, look for those opportunities to do business in a different way than what we thought was normal, but yet are finding it can be just as, if not more effective. So, as a lot of engineers are working remotely, as a lot of IT professionals are working remotely, as a lot of finance people are working remotely, they don't have as many distractions as what they sometimes do at work with meetings and traveling to and from work and et cetera. And how can you be more effective that way? And as you try to interact with your dealers and as you try to interact with your customers, how can you be just as effective, if not more effective, by using FaceTime or Zoom or WebEx or just picking up the call? Mm-hmm. I have read that the prevalence of phone calls has pretty much doubled during COVID-19. So a tool that had kind of started falling onto disfavor, and people weren't answering the call when your phone was ringing, and they have the time to do it now. So those would be a few areas I would say.
Okay. Jason, thank you so much for your perspective. I really appreciate you taking the time. I'm sure that your insights are valuable for other leaders and others in your industry.
Thank you. It was a pleasure to participate.
Now, let's get clinical. A few things stand out to me from this interview. First, health screening on the production line, and second, efficiencies as a lesson learned. On the first, I appreciate hearing how his company focused on health protection of the workforce through health screenings, beginning with self-reported questions on exposure risk and symptoms, and now with temperature screenings. He also has been able to secure protective equipment for those on the production line who work in close proximity, and everyone else who can works remotely. I like what he said about not reinventing the wheel, that there are great leading institutions such as the Centers for Disease Control, the CDC, and the WHO, the World Health Organization, out there who put out guidelines which his company has followed. This is good practice to lean on science and the experts when thinking about new policies related to COVID-19. And I know from speaking with him earlier that COVID positive cases within his workforce are at a minimum as a result. On the second, in our new virtual paradigm, many of us are forced into operating through technology, and as such, although nothing replaces in-person connectedness, Jason notes that there are other benefits to connecting this way, which have resulted in a shift towards egalitarianism in the example he provided. Many leaders are noting unanticipated efficiencies and innovations as a result of working within our physical distancing guidelines. Although this is not exactly clinical, I highlight it because it's a silver lining in this time of adversity. I'm Dr. Ali Sharma. Thank you for watching Coping with COVID-19.